Dr. Claw, thank you so much for being here.
You're welcome.
Will you tell them a little bit about your work?
So I'm a professor in the Department of Anesthesiology, and I lead a large pain research group that does work trying to identify the underlying mechanisms of acute and chronic pain, as well as the most effective treatments.
Very interesting. So what does it mean to consider pain as a fifth vital sign?
So in the 1990s, there were several organizations, the Joint Commission that accredits hospitals, the Veterans Administration, that decided that they wanted their healthcare providers to take pain more seriously, and part of that was to promote that pain should be measured the same time that you measure someone's temperature, their pulse, their blood pressure, their respiratory rate, and thus it was considered to be the fifth vital sign. But this was a way of getting healthcare providers to take pain more seriously, because if you asked about it, then theoretically you would act upon that if someone said they were in fact in pain.
Yeah. Are there advantages and disadvantages to considering it as a vital sign?
Well, that clearly led to some unexpected and untoward consequences. One of the problems is that once you start asking about pain, then you really should do something about it. And what then ended up happening were there are a lot of patients that are in, for example, inpatient settings after some minor surgery or after they have a dental visit or something like that, that would be expected to be in some pain because of what just happened to them. But what ended up happening is, by making that the fifth vital sign, by asking about it as often as it was asked about, and as companies were then starting to promote the broader use of opioids for both acute and chronic pain, there's a lot of evidence that that fifth vital sign initiative drove up opioid use both on the acute pain side as